Kentucky Department of Health says cases of whooping cough are now increasing in Kentucky. According to the department, whooping cough is a respiratory illness that spreads very easily from person to person. It can infect anyone, but infants are at the greatest risk. U of L Health says it starts out like most sicknesses, with a stuffy nose, maybe a fever, but then after that and after a week, it turns into an extremely violent cough. U of L Health says the best way to prevent whooping cough is by staying vaccinated against it.
Unfortunately, as we learned with COVID, vaccines do tend to wane. That is, their effectiveness does tend to wane. One thing that has always been shown, however, people who've been vaccinated against whooping cough, uh, when you talk about severity of illness and death, those are definitely minimized, very minimized.
U of L Health says if you think you might have whooping cough, immediately follow up with your healthcare provider. They'll probably ask you about your Tdap vaccine status. The CDC recommends the Tdap shot for adults every 10 years.